Good evening, everyone. It is my honor to welcome you all for this podcast series, a great initiative of our Fogsi President, Sunita Tandulwadkar ma'am. Today, I, Dr. B. Kalpana, Fogsi Infertility Committee Chairperson, will have a conversation with Dr. Chokkalingam, a reputed cardiologist. So to bless this program, we have our Vice President of Fogsi, Dr. Komal Chavan, who is well known for her dynamic activities in Fogsi. Let me introduce her credentials. She is the past chairperson of Fogsi Medical Disorder Committee, and she is also director of Chavan Maternity Nursing Home. Currently, she is heading a unit in Desai Hospital and also honorary professor of Cooper Hospital. She has also received various prestigious awards for her activities: Best Committee Award, Reshma Pai Award, Shailaja Pandit Award, Durusha Award, and many more. She is also associated with various organizations like ISOPAB and Menopausal Society, and into International Federation also. She is the peer reviewer of Suffolk Journal, and she has got the credit of editing 15 books and 10 newsletter. Requesting you to bless this program, Dr. Komal.
Thank you. Thank you so much for the introduction, Dr. Kalpana. And it is a great pleasure to be part of this lovely, interesting podcast series by our President, Dr. Sunita Tandulwadkar. And we welcome all our dignitaries today. And our speaker today is none other than Dr. V. Chongalingam, and a cardiologist who is going to actually talk on how to make your heart stronger and be healthy. I think everybody wants to be healthy, and the heart is going to control your entire body. And when we talk about women's health, we talk about the overall health, and so much lies in our heart, and the heart health starts early in life. And in the reproductive age also, we really need to take care of the heart, so that later on, when we have a menopausal problem, we have so many patients coming up with the cardiac cause. So heart, women's health, and how to make them strong is, I think, the burning topic, because we see so many things happening. We read so many incidents related to cardiac day in and day out. So I wish this podcast a big success. Dr. Kalpana is our chairperson of the Infertility Committee of Fogsi, and she is a very great speaker and a person who would be guiding with Dr. Chongalingam throughout this podcast. And we have all our viewers who are glued in to listen to this and get inspired and take the learnings from this podcast into their daily lives. So over to you, and wishing the great success for this podcast. Thank you so much for inviting me.
Thank you, Dr. Komal, for coming and blessing this podcast. So
I will be joining and viewing you by the viewers link, and so the entire limelight goes to Dr. Chongalingam and Dr. Kalpana.
Today we are going to discuss about stronger hearts and healthier lives. So, Dr. Chokkalingam, Professor Dr. Chokkalingam is a reputed cardiologist, former director of Madras Medical College, and his excellence had been shown in his UG, PG, and also during his DM cardiology, and received various prestigious awards, including International Award of Excellence in Cardiology, and he has also published 100 scientific publications, authored many books. Welcome, sir, for this wonderful podcast.
Really very happy to join you all. Really happy, Kalpana, to be with you and our team. And I'm really honored through this podcast to want to communicate to the society how everyone can take care of the health especially the heart sore by, they can lead a very healthy life. We'll be all surprised. Now I am completing 8 years of my age. But I feel as though when I'm talking to you all, my age is only 30. And you'll be much more surprised that till today, even though I've been practicing cardiology for the last 60 years, I never taken even a single tablet. It doesn't mean that we can stop the medicines once we listen my talk, but definitely consult your doctors, because this one I want to aim for the medical professions, paramedical, and those who are doing this part. I feel this is a very important topic. I'm very appreciate this theme, how you are concerned for a society, how we can communicate our knowledge to the society, thereby we can make our society healthy. You know that, Kalpana, you always say, the greatest wealth one can ever have is, what do you feel, Kalpana? What is the greatest wealth?
Health is the greatest
That is
wealth.
true, very good. There is thousands of years they said, health is wealth. We may have million, trillion money with you. If you lose your health, it becomes zero value. So that is what we all must take care of. I used to even say, after one, add any number of zeros, you become more and more richer. The moment you remove the one, it becomes zero value. The one what it stands for is your own health. You are responsible for that. So what I am saying, most important topic today, how one can take care of the health of the heart. And I'm more interested in communicating the message through your dialogue to our society, Kalpana. I think it's very useful to everyone.
Yeah, we'll start our conversation. Many a times cardiac disease is missed even for medical professional. In your experience, can you please tell us what are the warning symptoms or signs that had been missed or ignored, resulting in major issues?
Very important question. Now, highly prevalent is heart attack. Globally, number one killer, heart attack. 2 is cancer. 3 is accident, including fall, suicide, whatever thing, plus all the diseases. So the 3 major killer diseases, you will be surprised, Kalpana. The moment if you keep your mindset positive, all the 3 can be prevented. Your question is focused on why the doctors are. Now, these diseases become much more commoner among medical profession, supposed to take care of the health of the others, and it's become much more common among cardiologists, unfortunately. And you'll be quite surprised, you know that in Europe, Canada, America, the burnout phenomena, the physicians, they go for acute depression, all ailments, including suicide, is commonest among doctors, is now spreading over Asia, India too. The reason is they're ready to take care of the health of the society. Unfortunately, they fail to take care of their own health. And you'll be quite surprised. Now I'm taking 4th generation of my students in DM cardiology. You'll be quite surprised because 60 years we'll have all the generations. Last few months, what upsetting me, Kalpana, every month, 1 or 2 of my students are dying because of coronary events. Sudden cardiac death.
I want to ask, why? Because considered as it's a old age disease, but nowadays even young age, few persons die of major cardiac issues.
Very important question, Kalpana, and you'll be quite surprised. In our country, every an hour, 90 people are dying between the age of 20 and 30, which is alarming, unheard of it before. So you must put a full stop for that. The reason is, please remember, every person get the maximum qualification. They're committed to work, they're working nicely, but they constantly lose their inner happiness. The moment if you lose your inner happiness for what you are committed, The losing of happiness, they become unhappy, stressed out, burnout. What happens? The adrenal hormone secretes, cortisol secretes. The same Chokalingam or Kalpana, anyone listening, you are going to enjoy their work. I am now working about nearly 18 hours per day, but I'm enjoying my work. So the moment you are going to enjoy your work, endorphin, happy hormones secreted. The moment you feel stressed, and stress hormone, cortisol, and adrenaline. So at the moment of life, you know how to balance work and life. And if you're going to be in the happy state with the cortisol or adrenaline at the lowest level, if you're going to increase the dose hormone, you know that dose means DOSE, dopamine, oxytocin, serotonin, endorphin. Among the four, most important endorphin. That is the happy hormones, they will secrete enormously within you as a powerful neurotransmitter the moment you are happy. Now our conversation, you are happy, I'm happy. Then your dose hormone is increased. The moment you feel this stress, adrenaline will come. So I personally feel all must be under stress. Without stress, we cannot be. Without stress, you cannot become a chairman of your association. I cannot be president of Cardiological Society. What I want to stress here is be at stress and keep the stress as positive. What do you mean with positive stress? Whatever thing you do, you extract happiness from that, it becomes positive. The moment you are unhappy, it becomes stress at the other one. So our mindset must keep it very clear. The moment you are happy, the situation may be changing, situation may be producing stressful, but inner happiness, we must not compromise less than. I will ask you one thing, very interesting, Kalpana, for a second I will show you, and it is very interesting for others to also to watch it. I hope you can see this visual.
Yes.
Have you see me this visual?
Yeah.
So this one is a zero level of no happiness. Okay. This is 10 is full happy. Okay, Kalpana? At what level you are living, Kalpana? Tell me now. At what level of happiness?
See, it is individual perception. I
Your
feel
perception.
everyone will have stress in their life at some point of time, and
Very
it
good.
is the personal perception. How do they handle and take it inside and make themselves stressful?
Okay. In what level you will be, Kalpana?
Probably somewhere around 7, 8.
Very good. I really appreciate your frankness and exposing. I want to make one point clear for the audience. If you're going to keep the happiness less than 10, if it comes less than 10, even 9, 8, adrenal is secreting. The moment if you keep the hormone, instead of adrenaline, only endorphin, those hormone, keep it at 10. Then you will be questioning in your mind is, how is it possible, Chokalingam? The environment definitely acute stress, everything that some people personally earning enormously per month, they say is 1, 2, because he is experiencing that life of stress that much. I agree with you. I'm very happy you are frankly telling me. I will now put one point. The external one, the number what you are going to say, let it be external. It may be 3, 5, 7, 8, what you are experiencing, but inner happiness, that the happiness you are going to keep within you, keep it at the 10. With the 10 happiness only, we must remove the unhappy situations. So it's the right to be happy within you 10. Nothing will happen up to 100 years. Suppose you become unhappy and you become fall ill, it is not going to give a solution for the problem. So most important, I want to make doctors especially never compromise less than 10 your inner happiness. Other things let it be there because there is no single individual in the world till today without any problem. If a person says I don't have problem, It's not human being at all. To be very honest, problems only making us to be alive. So I will ask you one question, Kalpana. Can you ask me, can you guess in what level I will be? Can you guess now, Kalpana?
Probably you must be somewhere around 9, 10.
Okay. I told you anything less than 10 is not good. So I decided to be all the time 10. To be very honest, Tokkalingam is at 11 or 12. So what I want to stress this conversation is happiness is limitless. In the limitless blissful state only, most precious, in value that cannot say with that one, that life can be saved. So never sacrifice, never come below 10. That's what. The situation, let it be anything, but be happy within you, within happy state. Because coming to the question, why people are losing their life is the work, the strain, the family, earning money, everything. Bring up the children. It's not an easy thing, but all the things in a place like that. Why it is happening? I will put it one interesting thing, Kalpana. It will be very interesting. You know that there's the coronary arteries. Am I clear?
Yeah.
So the coronary arteries are nothing but 2 to 3 millimeters left coronary. Sorry. Okay. Left and right, the 2 millimeter coronary. Agree?
Yeah.
That coronary artery is only carrying blood. I want to communicate one very important message, Kalpana. Very interesting for you. I think you can see the visuals.
Yeah, plaques.
Okay. Now see here, there's a coronary arteries. The coronary arteries, it carries cholesterol. If there is no cholesterol, life is impossible. Please remember, all our organs, everything because of the cholesterol. As long as we are happy, cholesterol will be only in the blood. Take care of. As I told you, if you become unhappy, Kalpana, adrenal cortisol, it makes the cholesterol to deposit. The cholesterol deposit in the coronary, cerebral, or any arteries because the stress hormone. But for that to occur, please remember, my viewers, it will take 15, 20 years to occur. Right, so 10%, 20, 50, 90, 100. But unfortunately, what happens, very important thing is here, if you see very closely, sometimes the clot will occur. Able to see a small black dot line. So obstruction to become 100 may take even 8 years. Then why at the age of 20, 25 people are dying? Because there is erosion in the endothelium and clot occurs. The coronary thrombosis is the important culprit responsible for sudden death within 2 minutes. So block to occur, it may take 15, 18, 20 years. But thrombus occurs within 2. Suppose a person is lost, an important person if I'm lost, job is gone, money is lost, acute stress, the small erosion in the coronary, the clot occurs. The reason why people die suddenly, Kalpana. So this moment we are going to be happy. If you are going to be in the happy state with the endorphin or those hormones, cholesterol will never deposit. There will never be any erosion, and the positive level, blood also won't clot. So please remember, the acute infarction occurs because of coronary thrombosis. Block is a chronic one. At the time, coronary artery also will go for like this, severe spasm. All three can be prevented by simple positive mindset. So the burnout phenomena, doctors dying, younger age because of they are not able to balance work and life nicely.
Yeah, stronger mind will lead to stronger heart. That is your message. And I also want to ask, there many a times cardiac disease incidence is higher in patients with a strong family history. Lifestyle also plays a role. And what is your advice for a patient with a strong family history to avoid this unnecessary problems?
Kalpana, you are asking like a cardiology conference. I'm really happy. The moment you were smiling and conversation, endorphin is increased. That must be our status all the time. Genetic plays a part. Suppose father, mother having pressure, sugar, coronary disease, cancer, all the things will be transmitted to children, grandchildren by none of their mistake. And one interesting thing I want to, allude further, widen it out and tell this fact is, you'll be quite surprised before going to the answer. Consider for our life existence, we need our body. So life is must for the body to exist, so we cannot separate the both. So for our existence, we need E. I made it as 3 E's. E, E, E. I will tell you, can you repeat when I'm telling you, Kalpana?
Yeah.
Emotion.
Yeah, emotion.
Eating.
Eating, yes.
Exercise.
Right.
So these 3 E's, last 60 years, I am telling globally, 3 mantras. I want everyone to register. Those who are going to watch that podcast repeatedly, replay it and watch it and impression in your mind and implement it. The 3 mantras are, please remember, be positive in thinking, be healthy in eating, be adequate in exercising. So 3 mantras, you will be quite surprised. Can you see this, the pointer? This cell is the one, your specialty, womb. This is the one, tomb. The line between the two is our life. The line of your life lies only in your hands. Please remember, people are very happy only in the womb and the tomb. The middle life, they lose their happiness, unhappiness, they get into that. I want to stress to our audience, please remember, this line can be nicely extended by means of inner happiness. The 3 mantras, I repeat once again, be positive in thinking, healthy in eating, adequate exercising. Please remember, Kalpana, this line can be extended. No, doctor, I won't listen. The line will shorten. You die happily at the age of 20 and 25. Option is given you. So please remember, never compromise the 3 mantras at any time. Now coming to a question of genetics. You'll be quite surprised, Kalpana. Before answering, please remember, if someone listening this talk, am I clear? See here. Listening, if they are going to have 99% block, Kalpana, if they are going to follow the 3 mantras from today, 1 year, 12 to 15 months, this block disappears. That is reversion of atherosclerosis. Am I clear? The same thing is true. The genetic predisposition, I already told you, if they are going to follow the 3 mantras from today, 9 years. How many years?
9 years.
9 years, the gene totally weathering off the genetic imprints on that. The reason is the genes or epigenes or phenotype, they constantly change to positive mutation, weathering off the genes carrying the diseases by constant mind signal and lifestyle, because the genes are phenotype or epigenes, they are also possible that it takes 9 years. So nothing is permanent, and this gene also is modulated by means of your lifestyle. Here I want to, because you are a gynecologist and obstetrician, you know that the heart develops very fast from the 4th week to 8th week of intrauterine life. That is the one one single cell divides, and as a human being, we have got 40 trillion cells. So one cell has become 40 trillion. So when the fast redivision of the cells and forms organs of all the one in the embryo, 4th week to 8th week. During that time, if there is going to be mental trauma, physical trauma, infection, drugs or X-ray, that mutation of the cells occurs. That is the reason why lot of you will be quite surprised. Now you get lot of cerebral palsy, congenital heart diseases, and now they are putting the theory autism also responsible for the newborn, more developed countries, because the first 4 weeks, 8 weeks, mental disturbance and mother giving the child of that diseases. So that also one must focus and prevent it. So no more it is genetic, provider difficult. But if you ask me, if I get 100 heart attacks, I cannot treat 100 patients like that. 90% of them, by lifestyle changes and medication, we can regress. But even today, 10%, I have to put stenting because regression will take 1 year. By the time I don't want to lose the life of the person, I have to do intervention like stenting. But nowadays, bypass surgery is not necessary at all unless they need valve replacement also. So one need not worry about genes. That is possible to get corrected.
Yeah, nowadays everyone is aware of annual master health checkup. But even after normal annual master health checkup, few do get major cardiac issues. And what could be the reason?
Excellent question, Kalpana. This is the one we have been discussing. What that I told you, the 9 years regression, 4.5 years ago, New York, 24,000 physician cardiologists. I took part, I talked there about 20 minutes. There, the genetic mutation to positivity, gene modification. For that, they got the Nobel Prize also on scientists. It has been become scientifically proven. Now, the question is, we give a master checkup. Everything's normal. That person wanted to have the coronary angiogram, that coronary angiogram also normal. I will not narrate the person's story that will give the answer for your question. His elder brother had a heart attack. This younger, I never treated him. The younger brother came to me, no, I want a master checkup. I did all tests, including angiogram. Everything is normal. I admitted at 7 a.m. in the morning. I discharged him at 2 p.m. Then he was asking me, now you told me, doctor, everything is fine. How can you guarantee my life? I told him, the guaranteeing of your life depends on you. Then as such, you are doing very well. I am very, very happy. All the parameters normal. But what happened, this fellow is living about 30 kilometers away from Chennai. He's having a pretty big industrialist. About 6,000 people are working under him. So what happened when he was traveling in the car with his wife from our corporate hospital to his place? When he got into that car, that CEO did not do what he expected. Immediately started scolding him under tension, everything. He was surprised, Kalpana, when he landed out in his house, when he got down, he dropped dead. His wife was telling him repeatedly, please never become tense-up. Choklaim has not told you. He never listened. We lost him. What happened? The acute stress, please remember, the vessels are normal. As you see, the erosion because of tension, clots that produced total obstruction, we lost it. So ultimately, please remember, only thing that can save them is how their inner happiness is. So most important question I asked, I hope I made this point very clear. The moment if you lose, how acute, that is very important. The same token I want to tell, if you are going to be extremely happy, the extremely happy is going to be a adirchi chollavilla. Tuck is going to be emotional. That also may produce erosion. So you must know how to live in balance. Otherwise, you lose the life.
Yeah, keeping our emotions in control is the mantra, as you said. And you said one is exercise and one is diet. Can you please explain heart-friendly plate? Because many a times they tell cardiologists usually advise to avoid all whites. Then
Okay, excellent question.
egg
Now see,
whites rich in
not like
protein
that.
and
A very important question. This is a discussion universally, globally is going on. So first of all, I will repeat once again, emotion make it positive. I used to say happiness is very important. Many they define when you become successful is happiness. It's not correct. I am telling happiness is the greatest success. With happiness, you climb the stairs of what you want to achieve. That's one aspect. Now, as far as diet is concerned, I will tell you, you are going to have one plate. Half of the plate, please keep only vegetables and fruits. Off. Quarter plate, carbohydrate of rice and wheat. Quarter plate, protein, without animal fat, lot of fat. Lean, white fat we can take, like what? Chicken or fish, all the things we can keep, or vegetable protein, whatever thing. And the water you must take minimum 3 to 4 liters per day. And salt, not more than 3 grams per day. Oil, you must keep it very, very minimal. I used to say, oil குறைத்து உங்கள் ஆயிலை கூட்டுங்கள் சொல்றது தமிழ்ல. Reduce the oil and increase the longevity, like that you're going to say. When you are using the oil, what I want to say is that oil you must not be using saturated or oil with the fat. You all must know. Ghee is the animal fat. It contains cholesterol. Instead of that, you can avoid that one, rice bran oil, ginger oil, or sunflower oil, olive oil, all the vegetable oils, no cholesterol. But coconut oil, no cholesterol, because any food from the vegetable kingdom, even all nuts are zero cholesterol. But taking more, it will produce more weight. Coconut oil, no cholesterol, but coconut oil contains plenty of saturated fat. That saturated fat, liver will convert into cholesterol. So avoid that type of oil. Milk we can take, but avoid the cream of it. Rice, keep it minimum, and salt also minimum. I always want to stress one point. If you think rice is bad, equally bad is your wheat also. They are both. Please, that now many are aware of it. Very important. Yes.
and after a cardiac disease is diagnosed, you already told emotion, exercise, and diet are really important. How do they balance their exercise? Too much is also not good for them. Too less is also not good for their maintenance. And how do you? Because by 50 and 60, many a time 75% have mild or mild cardiac disease. So how do they go for exercise and to maintain their lifestyle?
Very important exercise. By exercise, suppose a person gets infarction on stenting, first 3 weeks, I told them routine activities, exercise per se for a cardiac workout, they can start doing from the 4th week of all the procedures after the heart attack also. But under the guidance of cardiologists, when they recover totally, after stenting, they can do tennis, they can do marathon, Olympic, everything, but with a balanced outlook like that. And here I want to stress, suppose the age of 40, 45, you got an infarction, stenting, they feel that they should not have family life at all. They can have family life with his wife, provided first 3 weeks to avoid. After 4 weeks, they can have it, but without any much of emotions like that. And that also helps them to recover more and more because of emotional stability. So exercise is mandatory. I will ask you one question, Kalpana. How many heart everyone has got? Tell me. How many heart?
I think physically one heart.
Very good. Physically one, I appreciate. There are three hearts. One is this heart. The two calf muscles, right and left calf muscles are peripheral heart. Second and third. Unless you activate the peripheral heart, pump in the leg cannot be pumped up unless you active the pump blood into the heart will work nicely. So human beings are meant to be kinetic, standing, walking, jogging, cycling, swimming, anything but make you active. Once you lay down, blood will go down. So exercise is mandatory. I want to tell you, you may be knowing, I am even today in the 9th floor of my cardiology department. I am an emeritus professor. Till today, I never used even single time lift, Kalpana. I'm always using, never used lift. I always climb up and make it that exercise climbing a very important thing for our life. So must. So over exercise, for example, they are doing in the gym more than what they should do in marathon, competitive exam, or the people are dancing in that floor of the wedding. When they become emotional, overjoyed, that also may produce crack. Never do anything more than what we can. That is what we must be balanced. I'm not able to hear you. You muted, Kalpana. Yes. Unmute. Yes.
Weight reduction actually really helps in protecting our heart. And what is your opinion about weight loss drugs
Very good.
that have been marketed so extensively nowadays?
Now, weight reduction, I want to make one precaution. The over exercise you may do, that weight reduction may occur only 5%. 90% of the weight reduction, only what you take, especially rice and carbohydrate or wheat, cut down. And instead of 3 meals, adults, we need only 2 meals a day. And take this dish of what I was told, one food, how you must, percentage of the food, that what you should take. Food is very important. Without food, it's not possible. That's what I used to say. If you stop breathing, 3 minutes, you will die. If you don't take water for 3 days, you will die. If you don't take food for 3 weeks, you will die. All the things are mandatory. We must keep it everything optimal. Anything excess. So don't think exercise, weight we can reduce by doing only exercise. No. First reduce your weight by your dieting and then regular exercise. Suppose you're going to have a knee pain or joint pain or anything, never do exercise unless the pain is relieved, and then start doing that and keep the weight optimum. Very important.
And coming to cardiac disease in women, is it different from men in their symptoms, risk, and even in pregnancy?
Very important question, Kalpana. Before, when it's about 60 years before, I never seen a lady when they're menstruating getting heart attack at all. After menopause, both are equally affected. Now I'm seeing women also in the work field, women also stressed, and what the estrogen secreting and protecting them for atherosclerosis, that estrogen effect is lost because they're overstressing and they're allowing the adrenal cortisol to increase more and more, and women also equally affected. The 20 to 30 years, I'm telling 90 people per hour dying, it is both equally male and female because the lifestyle, what they have changed. So they are all the time fast and everything, fast. They want more and more till they are no more. That's what I used to say in short, please avoid hurry, worry, curry to get buried.
So nowadays, even a popular actor, while doing his fitness activities in a gym died immediately after his exercise. So many
Yes.
things we
Many
get.
incidents, not only that celebrate, many people, because he has been over-stressing, that exercise, what he has been doing is not necessary for human being at all, and is unprescribed excess, load of exercise, with the hope that he wants to have the good build, six pack like that, it will kill him also. Decide what you want. Balance your exercise also very carefully. That's very important. That because I never seen him. Once he died, all the televisions I gave a interview. Please remember that. He's at least more than 40. Now I'm seeing 27, 28, 39, 32. Youngsters during gym. I'm not saying gym we must not go. What happens? They fix up a time. They want to do from 6 a.m. to 7 a.m. At 6 o'clock, they start the gym. This happened when I'm a student, house surgeon, very smart, her marriage has been fixed up after 3 months, that is in April. She wants to reduce only 1 kilo. She got to the gym at 6. She started doing, but only thing, she got a call. She asked to finish earlier, and she was very much worried about reducing 1 kilo. 1 kilo. When she was doing gym, she had an infarction. We could not save her. So anything, do it with that, because any exercise will produce endorphin. The same exercise, if you're going to overdoing it, it will produce adrenaline and stress hormone. So always balance only ultimate point, Kalpana. So
is there any predictor before going to heavy weightlifting to avoid all those
yes,
attacks?
now the mandate is, if you want to do a maximum cardiac workout, they must get cardiologist opinion. Whether they have got pressure, sugar, echo, stress ECG, stress circular, because we must be very careful. Suppose a person have done everything normal, still as a narrator, one person, a business person, acute says erosion of the vessel dying. So mandatory of this talk is never lose your happiness. Live in work and life in balance. So work is worship. Doesn't matter what you're doing. Enjoy your happiness from that. Then you are equivalent to meditating.
And future is about AI. What is the role of AI in cardiology, sir?
Definitely, AI is going to give a very great, enormous clue for us. Suppose screening of, I can say per day 100 ECGs, 200 ECGs, millions of ECG, 1 minute will tell you, because of the changes, this will have predict like that. But I am very confident, or even coronary angiogram, this much a block of this ratio, this will be giving the risk ratio, everything. But individual patient dying, one cannot be predicted, only the mindset of that, but the business person I narrated. Why that fellow dying during dancing? Why that fellow during rounds, and I'm a student dying? All the things nobody can predict in the earth. Any come is individuals. I used to say, yeah, artificial intelligence is very important. That more than that, real intelligence of your individual intelligence, that emotion will be positive. I used to say instead of AI, IA is individual intelligence to keep him healthy and life extended.
So now we have various smartwatches and Apple Watch giving
All the
a
gadgets.
message that it can identify cardiac risk.
Excellent.
And is it really possible? And
all the things, blood pressure, pulse rate, blood sugar, everything. Please remember, these people are wearing that Apple Watch. I don't wear it like that. They'll say, I want to finish 10,000 steps today. By chance, they reduce by 1,000 steps or 500 steps. That worriness is much more bad and don't bother watching and doing like that. Once the blood pressure is very important. One person is instead of 140/90 upper limit, 5 millimeters more every an hour is checking the pressure. The checking the pressure every an hour is psychological trauma. So all the things have that, but you know the limitation of that. Don't driven by the gadgets.
Yeah,
Very
don't
good.
overtrust the
That's
gadget.
very good. Correct.
So, what is the latest technology for screening and management in cardiology?
Now, above the age of 20, both sexes, they must have minimum 5 tests. What are the 5 tests are? Blood sugar, blood cholesterol, blood pressure, ECG, and XHS. The 5 is mandatory because the first 3 are pressure, sugar, cholesterol, they are all silent killer. Identify that, treat that. After 20, every 5 years you will do that, is enough. After 40, every 3 years. After 50, every 2 years. And after 60, every year. But the duration of intervals depends upon the individuals whom you are testing. You must monitor
Previously, the cardiac disease is not diagnosed much. Nowadays, with the annual master health checkup and various technologies, cardiac disease is diagnosed in a better way. Now, are we using stents? Are we overusing stents nowadays?
Good. Very important question. As I told you, out of 100 patients, 90% I make them cure by the 3 E's, medications, everything, and most important, the emotional status. But 10% of patients, I put them stent, primary stenting. Once you feel that we may lose the patient in 1 year, I don't want to take risk, which we can assess by seeing the patient. So only one is, nowadays there is no need. By means of putting stenting, we can put 1, 2, 3, 4, 5, 6, any number of stents, and more beneficial than bypass surgery is stenting. Now the longevity of stenting is many, many years, provided they take some medicines, dual antiplatelet first 1 year, then single antiplatelet, they must continue, lifestyle modifications. They will do extremely well. Only precaution I want to tell, those who undergone stenting and bypass surgery, or even heart transplant, all the things are all temporary. After that, must modify the 3 mantras. I am very confident another 5 to 10 years, Kalpana, the field will be occupied by gene therapy, genetic modulation, genetic identification, genetic engineering, all the things going to replace. They will have a very great scope in future. There is no doubt about it.
In your practice, can you please tell the greatest challenge you have faced in treating cardiac patients?
Every patient is interesting. No patient, I have seen thousands of infarctions, each patient is identical. I cannot say that 2 patients are similar patients like that. In my experience, I put the first pacemaker in our South India, except that Siemens Hospital they were doing about 60 years before. I put one small child, Kalpana, by name, your name Kalpana. She born with congenital block. I put the pacemaker, and now 4 times replaced that every 10 years. Now she has become mother, and soon I heard that daughter has become doctor now, and she is going to become grandmother soon. It all depends number of challenges. One patient with engineer, you won't believe me, had an infarction. 44 times heart stop. I gave a DC version, and then luckily we were able to put the stent. He is doing very well, but generally he can do it smoothly.
Okay. So, what is the final message to patients and cardiologists also?
And not only patients, not only doctors, for the public, what I want to communicate, Kalpana, please see here. What is the thing you are seeing here? What is that?
This is a calculator. Right?
Calculator. Life is a calculator. Add good things, deduct bad things, multiply knowledge, divide your time, live in balance. Once you follow this mantra, one small request for everyone, never copy your life through others. Your life is yours, you must have the journey. And please remember, everyone's journey is a pleasant journey. It is not a race. Once you compare my life with others, I have to race my own life. I must live in a pleasant way. So you all can outlive more than 100 years. I really appreciate Kalpana for the excellent question. I hope everyone benefited. Thank you very much.
Thank you so much for your message to everyone, sir. Once again, I thank our Fogsi President, Sunita Tandulwadkar, for giving us this wonderful opportunity. Thank you.
Thank you, madam.